Happy Tuesday to Modexus. This is Ellen coming to you from my beautiful office in Vancouver. On the weekend, we did a deep dive into diabetes and cardiovascular disease and the relationship between the two. So in America, 73% of the population is either diabetic or pre-diabetic. That's from kids to adults. Very large percentage of the population, and they don't know it because they don't go and have blood tests and they're not tested for it. If you're concerned about it, you need to have your A1C tested. That's the number one test that you should do, and start following your A1C. If you have diabetes or cardiovascular disease in your family, you need to start monitoring A1C, your insulin, and your inflammatory marker called C-reactive protein. So what can we do about this situation if we're not able to exercise? Can't really change our diet or not willing to change our diet, but how can we reduce the risk factors for both diabetes and cardiovascular disease? And please understand, if you're diagnosed as a diabetic, you also have cardiovascular disease to some extent. We're not maybe talking about your heart, but your cardiovascular system is 60,000 miles long in your body, so there's going to be some challenges there. Second of all, if you have cardiovascular disease, you have some measure of insulin resistance. That's part of cardiovascular disease. So these are very linked diseases, and the more we study them, the more links that we start to see. So on the weekend, Dr. Fung was talking about the number one thing that we should do and could do before we start exercising, before we lose our weight, before all these other things, is dramatically reduce the inflammation in our cardiovascular system. Where does that inflammation come from? Well, when we're insulin resistant, so we might not be diagnosed as a diabetic, but we could be insulin resistant. When we're insulin resistant or a diabetic or have cardiovascular disease, we have some measure of insulin resistance. That means we have extra insulin in our cardiovascular system and we have extra sugar. Those are both inflammatory. The sugar can't get inside your cells, so we have a lack of cellular energy, or we often will feel fatigued, we don't feel like exercising, we don't feel like doing a lot of things because we're just not able to use sugar as a source of energy. And in addition, if we can't use sugar, then we really can't use fat, because as long as there's sugar and insulin in our body, we can't get to our fat stores to actually burn them. Anyway, complicated. So in the context of Modexus, what can we do? We can dramatically reduce inflammation. So remember, we have a Health Canada claim for the ashwagandha in Probio Balance as an adaptogen and an anti-inflammatory in the cardiovascular system. In Lonicera longevity, not only do you have glutathione, but you have Lonicera berry, which is many, many times stronger than blueberries, which are the gold standard in antioxidants in fruit, except Lonicera berry are many times stronger for their effects on the cardiovascular system. So we have two powerful anti-inflammatories in Lonicera longevity and Probio Balance to help 73% of the population in the first step that they need to do in battling cardiovascular disease and diabetes, reducing inflammation. How important is that? Well, studies have shown that you can reduce the risk of a cardiovascular accident, in other words, a stroke or a heart attack, by up to 70%. Now, of course, that's individual. That was the sort of outside marker, was 70%. But even if you could reduce 25 or 30% by reducing inflammation, it's still worth it. So that's the first thing that they talked about, was dramatically reducing inflammation both in diabetes, cardiovascular disease, or the combination of those diseases. And we have a great answer to that in the Probio Balance Lonicera longevity duo. Have a great day. We'll talk to you soon. Bye for now.